Hi friends, and how are you? Hope you're all doing good. Welcome to my channel, PSYCH Degree. This video is on the impact of childhood trauma on adult relationships. This is another interesting topic, which I'm going to talk in this video. A brief introduction about childhood trauma is that the factors such as abuse, neglect, or loss can have a profound effect on our emotional and psychological development and can greatly impact the way we form and maintain relationships in adulthood. Well, before starting the discussion, please do like, share, and subscribe to my channel for more important contents related to psychology. Now, let me begin the discussion. First, let's talk about the impact of childhood trauma on our emotional development. Trauma can cause a person to develop unhealthy coping mechanisms, such as avoidance, numbing, or dissociation. These coping mechanisms can make it difficult for a person to form healthy emotional connections with others. They may struggle to trust others, experience difficulty in forming healthy boundaries, or find it hard to express their emotions in a healthy way. Additionally, childhood trauma can lead to the development of mental health conditions such as depression, anxiety, and post-traumatic stress disorder. These conditions can make it difficult for an individual to form and maintain healthy relationships. They may struggle with feelings of guilt, shame, or worthlessness, which can make it hard for them to trust others or to feel worthy of love and affection. Another impact of childhood trauma on adult relationships is the tendency to attract unhealthy relationships. Traumatized individuals may have a tendency to attract partners who are emotionally unavailable or abusive, as they may unconsciously seek out situations that mirror their childhood experiences. They may also struggle to identify and end unhealthy relationships, as they may not have learned healthy relationship skills or have the emotional capacity to leave. Childhood trauma can also have an impact on the way we parent. Traumatized individuals may struggle to provide a safe and nurturing environment for their children, as they may have difficulty regulating their own emotions and may struggle with feelings of guilt or shame. They may also struggle to set appropriate boundaries and may struggle to recognize when their child is experiencing abuse or neglect. It's important to note that healing is possible. With the help of therapy and support, individuals who have experienced childhood trauma can learn to overcome their past experiences and develop healthy relationships in adulthood. Therapy can help individuals develop healthy coping mechanisms, work through unresolved emotions, and learn to trust and connect with others in a healthy way. In addition to the impacts on emotional development, mental health, and attraction to unhealthy relationships, childhood trauma can also impact the way we communicate and interact in relationships. Traumatized individuals may struggle with communication, as they may have difficulty expressing their thoughts, feelings, and needs. They may also struggle to understand and interpret the communication of others. This can lead to misunderstandings and conflicts in relationships, and can make it difficult for them to form and maintain healthy connections with others. Childhood trauma can also affect the way we perceive and interpret love and intimacy. Traumatized individuals may have a distorted view of what love and intimacy look like, as they may have learned unhealthy patterns of behavior and communication in their childhood. They may struggle to recognize healthy love and intimacy, and may be more likely to accept and stay in unhealthy relationships. Another aspect of childhood trauma that can affect adult relationships is the tendency to experience triggers. Triggers are specific events, situations, or people that can cause an individual to relive their traumatic experience. These triggers can cause feelings of overwhelming fear, anxiety, or anger, and can make it difficult for an individual to be present in their current relationships. These triggers can also cause flashbacks, which can make it difficult for an individual to maintain healthy boundaries and relationships. Further, childhood trauma can also affect sexual intimacy and sexual relationships. Traumatized individuals may struggle with sexual dysfunctions, such as sexual disorders, or have difficulty feeling safe or comfortable during sexual interactions. They may also struggle with issues of trust, control, and boundaries when it comes to sexual relationships. It's important to note that healing from childhood trauma is a long-term process. Yes, my friend, you heard that right, it is a long-term process, and requires a lot of hard work and dedication. It requires patience, self-compassion, and self-awareness. It's important to understand that healing is not a linear process, and that individuals may experience setbacks and challenges along the way. However, with the help of a therapist or counselor, individuals can work through their past experiences and develop healthy relationships in adulthood. If you, or someone you know, has experienced childhood trauma, it is important to seek out help and support. Remember that, as I mentioned earlier, healing is possible. With the right resources, you can learn to overcome your past and build healthy, fulfilling relationships in the future. In conclusion, the impact of childhood trauma on adult relationships is complex and multifaceted. It can affect emotional development, mental health, attraction to unhealthy relationships, communication, perception of love and intimacy, triggers, and sexual relationships. However, healing is possible, with the help of therapy and support. That's it, friends, in this video. Hope the information is useful and valuable. Feel free to comment for any additional information. Thank you for watching, and once again, don't forget to like, share and subscribe to my channel, PSYCH Degree. See you again in the next video. Until then, bye and take care.